Welcome to CareTalk, your very best home for incisive debate about healthcare business and quality. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix.
John, we're talking COVID-19 again, and this time we're going to look at it from a Medicare standpoint. What has been the impact of COVID-19 on the Medicare population?
Well, again, Medicare is the government's program that takes care of the elderly, folks over 65 and the disabled who meet the federal qualifications under 65. It's been devastating, David. Whether it's everyone's afraid of COVID, but 80% of the COVID deaths are over 65, and it's been devastating as well. The older you get above 65, the more dangerous this is to get. For those dual eligibles for Medicare and Medicaid, the incidence rates are about 4 times. And if you happen to be Black, you're probably 3 to 4 times as likely to get COVID. That's true of people of color in general. I think it's probably because of the essential workers. They're disproportionately folks of color. If you happen to have end-stage renal disease, it's the death rate is devastating on the poor and the elderly, and it's particularly targeting the elderly. And you can see that impact in the death rate, and that's true across the Medicare program.
John, it really is something. You sometimes hear about these things like vaccines for childhood illnesses, like measles and mumps, and it's been a while since we've had a new illness that really targets the elderly as this one does. There's been a tremendous scandal, quite literally, among nursing homes. The people in the nursing homes have been very hard hit. There's about a 25% death rate for people who get it in nursing homes. And sadly, our 2 states, John, Massachusetts and Connecticut, are the highest death rates in nursing homes on a population-wide basis. Nothing to be proud of there.
But David, there's a huge difference between an unavoidable targeting of populations by illness, and some viruses will attack the young. If you go back to the Spanish flu of 1918, it actually disproportionately killed people who were younger, those in their 20s, as opposed to those who were older, who actually persevered through it much better. That's a biological phenomenon. It's not something we can control. It's something we can protect against, and we should do a much better job at protecting our elderly. But let's be really clear. The reason those nursing home deaths are happening is because of a basic failure of controls, regulation, and an honesty about what we can and should be doing in nursing homes. Some nursing homes actually have protected their residents because they put the residents' interests ahead of the commercial interests of the people who ran the homes. There are plenty of homes where they've had challenges and folks have survived. Most of the homes where most of those deaths are happening, whether it's New Jersey, New York, Connecticut, or Massachusetts, are homes that were already in violation of a lot of basic regulations. And there are a number of other homes where nursing homes have actually either managed the virus without it getting out of control and too many people dying. This is a failure of regulation and a failure of prioritizing and honoring our elderly and our most vulnerable elderly folks in our population. We can do it right, David, but we have to be aggressive about policing and regulating nursing homes. And when we see a very clear and present danger like COVID, actually take action. I don't think yet, David, any of these homes where all of these deaths have happened, these death traps, have been shut down. I'm still looking for it.
No, you're right.
It's crazy.
No, John, you're absolutely right. Listen, I want to talk about Medicare Advantage, which is something that you're always touting. Clearly when COVID started, Medicare, CMS gave more flexibility to the plans on things like telehealth and waiving cost sharing and removing prior authorization and so on. What is the impact on Medicare Advantage of COVID-19? How have they been dealing with it to date?
Well, Medicare Advantage, again, that's the federal program where you join a managed care plan if you're part of Medicare. I actually think it's, there's so many examples of where we've kind of criticized the current administration or given them a hard time because of a boneheaded idea that they are pursuing, or a great idea that they're killing. But actually, because Medicare Advantage is really regulated by CMS, by this administration, let's take our hat off to them. They were flexible around quickly accelerating access to telehealth. They reduced the complications of handling the HIPAA, the privacy regulations. They waived cost sharing. They removed prior authorization. All of these barriers to care. They've really done a nice job at giving the plans the tools to and the patients the access to get care in whatever form they need to really protect the elderly. I actually think it's a point of real pride for the administration, where they've taken the best knowledge of flexibility and access from the private sector and applied it quickly in a crisis and fast tracked it, not waited for plenty, sort of the predictable lobbyists on both sides, but done the right thing for the patient. I don't know financially what's going to happen. In general, health insurers are swimming in excess cash because most people are afraid of going to see the doctor and going to the hospital. And that's not
Yeah.
just the elderly; it's folks our age, but it's particularly true of the elderly. But I think from a Medicare Advantage plan perspective, for Medicare Advantage market perspective, it's a really interesting time because they're accelerating and innovating faster than they ever have.
Well, John, what's interesting too on the financial side, let's just talk about how that differs from Medicare Advantage. They get paid based on how sick people are, how health challenged people are in terms of the different diagnoses they have. And one of the things that's happening is people are not going to the doctor, and so there's less cost for the Medicare Advantage plans. But if the cost is too low, they're going to have to give a rebate if it doesn't hit the 85% medical loss ratio requirement. And also the risk scores are going to be lower for 2021 because the patients appear to be less sick, and therefore the Medicare Advantage plans may end up with less money per enrollee next year. So it's a weird situation for them to be in. They're spending less, yes, but it's actually going to hurt them potentially financially.
Yeah, I'm not worried about our happy friends in the MA or health insurance world. They're actually well set up, I think, to deal with that. What's interesting though is they could be disproportionately, the plans that are disproportionately taking care of really sick people may not even be able to measure that. And when folks are more sick, there are risk adjusters that kick in. But I think the flip side of it, David, is we may find that not going to the doctor is one of the healthier things you can do. When we've looked in the past and looked at whether it's a physician's strike in LA or a physician's strike in Israel, when utilization goes down, all cause mortality tends to go down as well. And so it's a funny balance. But I do think you're right that some of these plans who have leaned in to take care of vulnerable, expensive sick people may not be compensated fairly next year. But we've got a really interesting live experiment as to how much care is too much.
John, there's another interesting angle on it, which is we've talked a lot about supplemental benefits. And one of the reasons people sign up for Medicare Advantage is they can get things like vision and dental benefits. That's been expanded to some other sorts of things like care at home or assistance with transportation. And those need to be looked at in a new light. I saw an analysis that suggested that certain things like going, a benefit of sending you to the gym maybe isn't going to be as popular since the gyms are closed, and maybe you don't want someone to go to the gym. There's other things that may be more popular. How do you think it's going to sort out on the supplemental benefit side post COVID?
Well, I don't think you want either your parents or my parents going to the gym right now. And I think that, but I suspect that the average person who's going to buy a Medicare Advantage plan is going to assume they're going to want their dental and vision and all that stuff. I think the really interesting thing to watch is in an economically constrained time when people don't have as much money to take their parents or their loved ones to the doctor's office. I think that transportation benefit is going to be more valuable. I think an extra food benefit, even if it's targeted at healthy food, would be really well valued at a time when you've got nearly 15% unemployment. I think the package, which has historically been, the way Medicare Advantage plans have competed around incremental benefits like hearing and vision, are going to be really that the ones that are leaning in more aggressively for things like transportation and food, which by the way are very much tied to access and health. They're not just they're not just kind of throwing incentives. They are really critically tied to better healthcare, and we've seen that through what the ugly phrase social determinants of health. But I'd watch the plans that have those benefits, because I think they're going to win in an environment where people are, really paying to a fixed budget. I mean, you still have 40% of America can't afford a $400 surprise bill with 14% employment, and unclear. It's really unclear whether the feds are going to continue to subsidize the economy with another excess $1 trillion bill. I think those are the benefits within Medicare Advantage to watch. A, because I think they're going to draw patients, and B, as they show that they work, you're going to see potentially Medicare Advantage providing a broader range of those social supportive subsidies or direct access to benefits that actually could ensure that folks live healthier and happier lives.
John, final question. You and I are not old enough yet for Medicare, although depending on Medicare expansion of, lowering the age for Medicare buy-in, if there's a President Biden next year, if you had to choose right now between picking a Medicare Advantage plan versus going into traditional Medicare, what would you do?
Well, I think there's no question from my perspective, I'd pick a Medicare Advantage plan. The statistics are really quite clear. You've got just as much access to care. There's more management and coordination, and there's less. It's much less confusing for someone like myself who has a hard time keeping track of all of the benefits and all of the pricing. Fee-for-service medicine is a bit of a mess. It's unclear what's covered, what's not, what your copay is. With Medicare Advantage, it's much more straightforward. The results are as good or better from a health outcomes perspective. And as long as the doctors you want are in that network, I strongly recommend Medicare Advantage. It's a better run program, and coordinated care over time is going to win.
Well, John, I guess if I have the opportunity next year, I'll take your advice. So meanwhile, let's wrap up now. We're coming to the end of yet another episode of CareTalk. We've been talking about Medicare Advantage and the impact of COVID-19. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. Thanks for listening.
Hey there, listeners. Want more Care Talk? There's more to be had in our other episodes, so be sure to look for those and subscribe to Care Talk on your favorite service.